Hey everybody, and welcome to Autism Awakening, the podcast that helps you help your child with autism. My name is Dr. Jared Skowron. I've been an autism biomedical doctor for 21 years, and this podcast is here to educate you as parents or caregivers or even therapists of kids with autism, how to help them medically. Autism is a medical condition, and treating it as such, in addition to your therapies, can really help your child improve their language, their behavior, their mental function, other health issues, and that's our goal. Our goal is to make our kids as good as possible. Now, we record our podcast live on our Facebook page, Spectrum Awakening. So if you're interested in taking part in a live recording of a podcast, you can even ask live questions. Just join us on our Facebook page, Spectrum Awakening, every Thursday at 12:15 p.m. Eastern Standard Time. I take my lunch break on Thursdays and walk you guys through one medical topic of autism and how you can help your kids. So let's jump in. Today's topic is oxalates, histamine, and ammonia. Now, I'm trying to figure out where do I begin here to make this most understandable. These are pretty popular things in the autism world that a lot of families and a lot of health practitioners are looking at. If you've had a biomedical analysis of your child, you may have had oxalate testing or something called oxalic acid. You may have had ammonia testing in the blood, and you may have testing for histamine. Your child may present with certain allergies, or you may have MCAS, MCAS, mast cell activation syndrome. So these three kind of parts of the body, these three chemicals in the body, can cause problems with our kids with autism, and that's why they're looked at, and that's why they're addressed. Now, I personally kind of disagree with what some health practitioners are doing, which is chasing the wrong rabbit. Okay. When we kind of look at things that are medical, there's a whole process of how something causes a problem, and our bodies as humans always try to stay healthy. Okay. We're always healthy. We try to maintain healthy. We try to maintain homeostasis and, really kind of make sure we're functioning as healthy as possible. When we're unhealthy or when we have symptoms, there's always a cause. Okay. There's always a cause. That cause creates biological changes in us, and those biological changes create the symptoms. So we have to step back medically and say, okay, what am I looking at? And what is causing the problem? And what is that cause changing that's creating the problems we have? So for instance, if we were looking at cholesterol, I could test cholesterol, okay? And hey, is my cholesterol high? Is my cholesterol low? Is my cholesterol normal? All right. And changes in that cholesterol, like high cholesterol, may contribute to heart disease and stroke. All right. Sounds good. Things that we completely know. Now, the question then medically is, where do I intervene? Where do I kind of affect people so they're healthy? Because we don't want heart disease. We don't want strokes. But how do I do this? So you can take a cholesterol medication. You could take Lipitor. My cholesterol goes down. Okay. Lower cholesterol, potentially lower risk heart disease and stroke. Or why is my cholesterol high to begin with? Is it because I eat fast food every day and I eat really crappy, and that crappy eating causes the high cholesterol that then causes the risk? So obviously I could change my diet and exercise, and that would lower my cholesterol and therefore lower risk of heart disease and stroke. So it's all about, where do we intervene along this flow chart, along this assembly line of cause, changes in the body, symptoms. So I want us to think of that, because I often see this same metaphor in our kids with autism when it comes to the oxalates, the histamine, and the ammonia. And we'll talk about oxalates first, because I think that's probably one of the most popular. You may get your oxalates tested. Now, you can do this through a urine test. You can do a urine test through a regular lab like Quest or LabCorp or a hospital, or you get it done on an oat test. So if you've ever had an oat test, an organic acid test, they have a whole oxalate section. And they could say, hey, look, these oxalates are high, and then we've got to figure out what to do about it. And I see a lot of health practitioners kind of go down the treatment road of, I want to lower these oxalates. They're high. I need to correct that. And so you may go on a low oxalate diet. You may go on a calcium supplement to bind the oxalates. So that will lower your oxalate levels, but it never looks at the cause. Because in my opinion, oxalate problems for our kids are not diet. All right. Unless your kids are eating 4 to 8 servings of raw vegetables a day, you're not going to get those oxalates. So, and I say raw because when you cook food, when you cook vegetables, you're going to lose about 50% of the oxalates just through the cooking process. So I see these kind of interventions and I just don't think they're really hitting the nail on the head. So that then backs us up and says, well, where do these oxalates come from? What's that cause of the oxalates? Or what's that cause of increasing oxalates? And what do those increased oxalates do that cause symptoms with our kids? Same thing with the histamine. Same thing with the ammonia. Are they just elevated and abnormal on their own? Or is there a cause? And if we can find the cause and we get rid of the cause, then we don't have to tinker and, do all these things to balance our biology. And so that's the way I want to go through things with you guys. I want to keep the big picture in mind, all right? Because there's so much minutia when we get to autism, when we get to testing. And I had an appointment with a patient last week and, we were on our telemedicine call for an hour because they really wanted to understand all this minutia of their lab results. What is this? What is this? How can I fix that? How can I fix that? How can I fix that? And we've got to make sure we're balancing understanding minutia and understanding the big picture. All right. So let's go big picture here, because the bigger issues that affect our kids with autism are things like genetics, which affect 1/3 of our kids and could frankly cause the autism. I was on a call with a patient today who had a genetic mutation of something called P10. P10 causes autism, okay, or causes developmental delays that get diagnosed as autism. So we've got genetics. We've got brain chemistry abnormalities. That's why, Spectrum Awakening was built on natural supplements that balance brain chemistry, and that helps language and behavior and sleep and even more. Then we've got mitochondrial problems in a lot of our kids. With those mitochondrial problems come immune deficiencies, and you start getting gut infections, you start getting autoimmune issues. So these are kind of the big pictures biologically, medically, what we're looking at with autism. Is there a genetic issue? Is there brain chemistry imbalance, mitochondrial dysfunction, infections, immune issues? So let's keep those big things in mind, because when we look at minutia, like oxalates, histamine, ammonia, those are created. Those chemicals are created by infections. All right. So let me say that again, because it's really important. I want everybody to make sure they heard that. The issues with oxalates, the issues with histamine, the issues with ammonia are caused by gut infections. So I can give treatments for histamine, I can give treatments for oxalates, I can give treatments for ammonia, but will changing those really fix the problem, or are they just Band-Aids like the Lipitor? All right. And that's where I think you guys can help your kids faster by understanding this big picture. So what I want you guys to think about is, if you've ever tested oxalates, if you've ever tested ammonia, if you've ever tested histamine, or you've got a child with MCAS, then think to yourself, hey, did they have a gut infection? Did I treat a gut infection in the past, and do they have a new one, or maybe that old one kind of resurfaced? And am I interested in testing for these things, or do they have any kind of gut symptoms? So if you're concerned about those biological elements, the oxalates, the ammonia, the histamine, I want you to investigate gut infections. All right. Now, quick review. We've got podcasts on gut infections. And so you can always go back and listen to those in detail, but you're going to want a stool test. You may want an organic acid test. That'll identify, hey, here's the infection. Let's go after it. Again, another example, I saw another patient this morning who had I think I already mentioned it, had a parasite infection. Yeah. Another child this morning had 2 bacterial infections, had C. diff and had Klebsiella. So these infections are in our kids, period. And they're diagnosed on stool tests. So if you think that those are issues, consider a stool test, or consider treating gut infections. You don't even need a stool test to do a gut cleanse. You can always try our Spectrum Awakening yeast mold bundle, which we recommend to a lot of our kids. A lot of our families use that and have great effects with it. Helps kids' behaviors, helps kids' language, helps mental processing. So that's where I want you to go. Now, let's get into the science that backs that up. Obviously, our podcasts are rooted in science and rooted in natural therapies instead of pharmaceuticals, but the science of the diagnostics needs to be there and the research needs to be there for us to understand things. All right, so let's start out with, everybody put your cheaters on. Here is a research study that talks about oxalates in autism. Again, we mentioned oxalates. Children with autism demonstrated a 3-fold greater blood oxalate levels than neurotypical controls and a 2.5 greater urinary oxalate levels than controls. What I found interesting, and I want to make sure everybody sees this, there was no difference between calcium oxalate crystallization rates between those kids with autism that had high oxalate levels and neurotypical kids who had average oxalate levels. The medical concern about high oxalates is that they cause kidney stones. Okay, that's why we don't want elevated oxalates. Just like the high cholesterol increases risk of heart disease and stroke, the high oxalates increases the risk of kidney stones. But with our kids with oxalate issues or high oxalate, it doesn't seem to be increasing the risk of kidney stones. Okay, so we don't have to worry about lowering those oxalates just to lower them. We want to go after the cause. Okay, all right. Next research study. Somewhat off topic. If you ever had porphyrin testing, porphyrin is a test that analyzes for toxic damage in the body. We have porphyrin tests on our Spectrum Awakening website. Abnormal porphyrin metabolism in autism can be associated with vitamin B6 deficiency, low magnesium, high homocysteine, which is caused by low B12 and low folinic, and high oxalates. So you may be involved in testing your child for toxicity by ordering porphyrin testing, but that high porphyrin testing may be associated with high oxalates and the gut infection. All right? Pretty interesting stuff. Now, let's understand oxalates a little more because, again, I found this stuff really intriguing. Here is a study about fungal infections and oxalates. Oxalic acid is one of the most common organic acids produced by living organisms. All right. You're going to see oxalates from living organisms like fungal infections, like Candida. Here's another research study that says oxalic acid is an important virulence factor produced by pathogenic fungal infections. What is a virulence factor? It is something that an infection does to make it live longer. So oxalates produced by the fungal infection help it survive. That's why it's up there. Brianna asked a great question. What are symptoms of oxalates and ammonia? You're going to be putting this, again, what's the cause of those? It's the infections. So what you're going to see are typical symptoms of gut infections, which is pain, which is behavioral issues, which is high anxiety, which is sleep problems, which is language issues. I've seen kids improve their language when you get rid of gut infections. So I just want you to think about mostly behaviors, sleep issues, hyperactivity, that kind of thing is the general symptoms that we're looking for. Okay. Medina asks, can I give alpha-ketoglutarate for ammonia if my child already has high alpha-ketoglutarate? You can, but I don't think it's going to, again, it might lower the ammonia, but we're not worried about the ammonia. We're worried about the infection. We'll get there. Hold on. All right. This describes that function a little more, which again, I find interesting. Oxalate secretion by fungal infections provides many advantages for their growth and their colonization. The formation of calcium oxalate crystals weakens the cell wall of our intestines. And there's a good correlation between pathogenesis and virulence and oxalic acid secretion, which means the more oxalates created by the fungal infection, the worse the infection and the worse the symptoms, because the yeast, the fungus, will produce the oxalates. That helps it adhere to our intestines better, and you get a stronger infection that creates more symptoms. So that's why the oxalates are there. It's something the organisms do to keep themselves alive. So this is why it's a marker that we use to indicate infections. All right. When I see an oxalate marker in the lab work that I order with my patients, I immediately say infection. I don't say time for a low oxalate diet. Okay. I don't want to fix the oxalates. I want to fix the infection that's causing them. All right. Moving on from oxalates to histamine, okay? Histamine we normally associate with allergies. So our body makes histamine, it's a protein, and it's very inflammatory. It causes inflammation from, with our nose and watery eyes and itchy skin, but it also creates a lot of inflammation in the brain. And that can cause behavior issues and sleep problems. So here's histamine in autism, and it shows that the average histamine levels are 5 times as high compared to the neurotypical controls. Okay, so our kids with autism have a lot more histamine in their bodies. And an amazing study, here's a study from 40 years ago, all right? It's almost 2025, so I'm just going to throw it in there. Back in 1985, okay, they were researching histamine being released by candida. That means candida infections, our kids' gut infections, is going to make the body release more histamine. Remember, we make histamine, it's from proteins. Our body's going to get that histamine circulating more and causing more symptoms with candida infections. We knew that 40 years ago. Okay, next. Histamine, not just produced by the body, can be produced by bacterial infections. So gram-negative bacteria, a certain type of bacteria, will produce histamine. Okay? So if you've got big histamine reactions, if you have histamine levels tested and they're elevated, if you have MCAS, okay, the mast cell activation syndrome, and there's just histamine everywhere, part of it could be from an infection. Could be from a bacterial infection, okay? Another thing that I see with MCAS and with histamine issues a lot is parasites, all right? Mast cells and histamine alter during parasite infections. In fact, antihistamine treatments reduced movements of bacteria, and antihistamine treatments reduced gut permeability. Antihistamine treatments reduced leaky gut. Why would histamine cause leaky gut? Because it's inflammatory. And if it's being produced by gut infections right there in the intestines, that inflammatory chemical creates leaky gut. So again, it's back to the cause. Here's another one. Parasites are the origin of histamine releasing factors. So please, if you deal with histamine issues, if you deal with allergies, if you're dealing with MCAS or esophageal eosinophilic, what is it called? Eosinophilic esophagitis. Sorry about that. Or allergic colitis. You might have a parasite. I see it so often. Get a stool test, figure it out. All right. Last but not least, and we'll kind of wrap up pretty quickly. Sorry, I've got these in a little mixed up order. I want to put them in a better order for us to understand life. Here's another research study that talks about how antihistamines can help. So this is amelioration of cognition impairments. This is an animal study, but improved cognition in the animal studies of autism by using an antihistamine. Now, this antihistamine specifically works in the brain. So we're reducing brain inflammation by reducing the histamine activity in the brain. It doesn't alter the cause of the histamine. The histamine is still floating around. It's just not causing inflammation in the brain and therefore reducing the anxiety and the sleep issues. But it's still, we've got to treat that cause. We've got to treat the parasite, the bacteria, etc. Okay. Last but not least is the ammonia. And again, the ammonia still fits into that general category of it's a problem. We don't want it. Okay. But it's produced by infections. And so if we have high ammonia, do we want to make sure we get rid of it? Yeah, we do. But you got to treat that cause. You could keep using alpha-ketoglutarate or whatever they're using to reduce ammonia, but it's like taking Lipitor. It's not stopping the problem permanently, which is what we want. So here's some few last research studies. Then we'll get into our live questions. Elevated ammonia in children with autism. Okay. Fecal ammonia or ammonia levels in the poop were significantly greater in autism than neurotypical controls. Okay. We see it. It's higher, but it can be from bacterial infections. As this study says, ammonia production by this bacterial infection, Klebsiella, does that contribute to the bacterial infection strength or intensity? Okay? Because we know bacteria produce ammonia, period. Now, ammonia is made from nitrogen, okay? And so any organism that releases nitrogen could potentially be converted into ammonia. And here's a research study talking about nitrogen excretion by a parasite. So parasites can do it. Bacteria can do it. You can get all of these biological substances. And where do these biological substances come from? Well, they come from the foods we eat, the water we drink, the air we breathe, how our body takes those substances and changes them and creates them in this wonderful body that we have, or from the bugs that live within us. And don't forget, there's 10 times as many bugs in our gut than cells in our body. There are quite a lot. And if they're producing oxalates, if they're producing histamine, or they're encouraging the body to release its histamine, if they're producing ammonia, those substances in abnormal amounts are going to cause problems. Most of those problems are behavior, all right? Most of them are the hyperactivity, the anger, aggression, the sleep issues, etc. So if you have behavior issues with your kids, they are very likely to be caused by gut infections. So go after and treat those, whether you're using something like our yeast mold bundle, whether you get a stool test and identify the infection and then kill it. Either way, that's going to be your quickest road to helping your child's behavior, but also changing all this minutia that we look at. I don't want us to get lost in the minutia of the lab testing. And that's where I think this group of oxalates, histamine, and ammonia are. They're the canary in the coal mine. They're the elevated cholesterol, because you shouldn't be eating fast food 3 times a day. Okay? And so instead of focusing on, I want to get that cholesterol down. I want to get those substances down so I'm better behaved, go after the cause. Because once that infection's gone, then all these other biological markers are normalized. You don't have to keep treating those on for infinity. So you don't have to go on a low oxalate diet, or a low histamine diet. So go after those gut infections. With this kind of stuff, think big picture. That big picture is immune system, gut infections kind of thing. Okay? And we do this with so many of our patients, because so many of our kids, like I mentioned, my patients today, we diagnosed a parasite, we diagnosed 2 bacterial infections. They're there. They're out there, they're in our kids, and they're causing problems. All right. I hope that was explained well. I want to make sure you guys understand that. Let me get to the live questions. Before we do, our coupon of the weekend. Coupon of the weekend is Histamine 20. Histamine 20 is going to get you 20% off any of our vitamins, any of our supplements, any of our lab tests, like the stool test, genetics, whatever you want. On our website, spectrumawakening.com. That expires December 15th, 2024. If you do want one-on-one help, if you want to have a telemedicine appointment with me, we do it over Zoom. You sit on your phone, you sit on your computer, you're at your house, you're in your office, you're in your car. Doesn't matter. It's 21st century. I'm here to help. So we can do that one-on-one help. I think I have 5 appointments left in January. So go onto our website, click appointments, find them right there. All right, let's get to our live questions. All right, live shout out to Sandra. Hey, Sandra. Kieran, what can be the reason of lethargy and laziness, as he's not taking any demands? If we push him, he starts to hit himself. All right, so, well, first off, if this is, sudden, I'd be worried about somebody being sick. Like, yeah, he's sick, and he's down and out. But if this is long term, it's not that. But I think what we need to do is really, kind of make sure he's stimulated. So normal causes of lethargy are iron deficiency, are thyroid problems. So kind of take a look at that. You may want to look for certain viral infections like mono, if he has other similar symptoms. So, look at the iron, look at the thyroid, look for kind of fatiguing viral long-term infections like mono. But you may also want to look into his dopamine. His dopamine or his mitochondria or his cortisol might be low, and those are stimulants in the body. So supplements like our Attention on the Double will boost dopamine production. Supplements like our Mitomax will help with mitochondrial energy production. And we've got our Temper Tamer that can help with the cortisol production. But I would, that's kind of where I'd go, Kieran. And that's kind of a big answer, because lethargy and laziness or being tired can be from so many things. And so it's really hard from a medical perspective to say, hey, somebody's tired, it's this one thing. There's a lot. There's a lot to go through. Kieran says, what about a CBS gene if it's double mutated? This is where you want to make sure you get on a good folinic acid B12 supplement. So, take a look at our folinic acid powder. Take a look at our multivitamin. Our new multivitamin, I think, is great. We've had great responses from a lot of our families. So I'm excited. And would have those things to help mobilize CBS gene activity. GADA, how can I help a child with sensory issues? Boy, GADA, sensory sure is tough. It sure is tough. There's a lot of talk about things like zinc, which can help a little bit, maybe GABA, which I think helps a little bit. But again, I want to get to that cause of the sensory issues. And I feel that it has to do with inflammation. It's inflammation of the nervous system that can be caused by these substances like the histamine that is from an infection. So I find with a lot of our kids, those sensory issues will improve once we treat those infections. I think viral is another potential place. I talked to a patient today who's 13-year-old boy. Real problems with dentist, real problems with haircuts. We did antiviral protocol for him. We used our ViraClear. He was also on our serotonin supplement and our anger management. And mom said he got his haircut and went to the dentist the same day and was able to tolerate it, which is amazing. It's amazing. All right, Kieran, my son presses his private parts with his hands on any furniture whenever we start a detox. Are those oxalates? I'm not sure if they're oxalates, and I don't think it matters. What I would do is add more binders, okay? Binders are going to grab anything that's trying to get out of the body and make sure you poop it out. You may want to try our gut binder, sweet tasting, or our yeast mold binder, but I would go down that road. Sandra, my son isn't absorbing B12 well. Doctor wants him to do the injections. It's safe to do, being the lid of the vial has aluminum in it. Yeah, I wouldn't worry about that. I don't want to add more toxic load. No, I don't blame you, but I think that should be okay. Molly, when trying to get rid of yeast, how long do we give activated charcoal with the prescription antifungals? How do we know how much to give? Boy, I would say this, the more the better, the longer you do it, the better. I would do it at least twice a day for 3 months, a minimum. But it will help you tolerate the antifungals. Sonia, hey doc, the question is not about oxalates, but I want to know what I can give my son to counteract the fishy odor that comes from carnitine use. You know what? I'm really glad you asked that, Sonia, because it's a question I don't hear often, but I do hear enough that I asked one of my colleagues that I respect a lot in our community, and he said that is due to bacterial infections. The bacteria will consume that carnitine and produce something that smells fishy in the body and comes out the skin. Crazy stuff. But again, back to infection, Sonia. Look for that bacteria. Gada, anxiety is the greatest problem in my child. What's the best supplement? Well, good question, Gada. Again, anxiety can come from so many things. It can come from everything we just talked about today. It can come from histamine and oxalates, and that's due to the infection. So you may want to kill the infection. If you just want to take the edge off, you may want to try our super serotonin supplement or our common cool supplement, maybe our spectrum tranquility. But again, do we want to, what's the cause of that anxiety? That's what we got to find out. Armando. My son's latest oat showed high oxalates and some bacterial markers. We did a stool test, everything came back normal. He takes vitamin C. What would be the best way to know if the oxalates are related to something in his gut? If you had an oat test with bacterial markers and oxalates, treat that. Okay. Stool testing is great to find infections in the lower colon, the large intestine, but it'll miss ones in the small intestine. Vice versa, the oat test will find things in the small intestine, but not the large intestine. So you may just have the bacteria up high in the small intestine, but you still need to get rid of it. I hope Enzo's doing well. Sandra, how do you treat C. diff? That came up on my son's oat test. First off, don't diagnose C. diff based on an oat test. Get a stool test to confirm, 100%. Okay. There are many bacteria that can produce those organic acid markers that are categorized under the C. diff in the oat test. So don't just say, oh, I got C. diff. You need a stool test to confirm that. But try our yeast mold bundle. Okay. Yeast mold bundle will help knock out bacterial infections. Molly, this is helpful info. I'm glad, Molly. My son struggles with sniffles year-round despite being on Zyrtec and vitamin C daily. Just can't seem to get his allergies under control. Well, I guess my question is it an allergy? Is the sniffle an allergy or is it something else? And the Zyrtec should work if it's an allergy. My question is, the sniffles are from the mucus. Where's the mucus from? Is it from allergies or is it from a chronic sinus infection? You just may have a chronic sinus infection that's just producing the mucus and it's not allergy based. And that might be mold. You can get mold in the sinuses. So that's what I would think about, Molly. Because look, medications work when you're treating the right thing, period. Okay? If you're treating allergies, if you have allergies, the antihistamine should help. But if it's not helping, it's not an allergy. So, but I see conventional medicine just kind of get stuck there. Molly says, can my pediatrician or gastroenterologist test for gut infections? Yes, they can. They can order the same exact test that I ordered from the big conventional labs. Yeah, they can. They don't, and I don't get why, but they don't. Some do. Sandra, is it true that zinc deficiency can be a factor in autism? Can we just give zinc, and if so, how much? Great question, Sandra. Zinc deficiency is common in autism. In fact, nutritional deficiencies across the board are common with autism just because of our kids don't have great diets. Zinc, things like zinc and magnesium are more often deficient just because the biological medical process of autism consumes those nutrients, so you lose them first and fast. You can just give zinc. How much? I would start with like 20 milligrams, maybe 40 milligrams. That's all in our new multivitamin if you're interested. All right. Brianna says, what's the best way to clean up the gut? Well, clean up the gut, I'm going to rephrase that question, is get rid of infections. Try our yeast mold bundle. You need a binder. You need a biofilm enzyme. You need something to kill it off. If you want more details, go back and watch our podcast on, gut infections. But I would do that. Medina already answered that question. Sandra said mold cause oxalates. I forgot the research, but oh yeah, look, fungal infections create oxalates. Yeast and candida are fungal infections, and mold is a fungal infection. So I believe yes. Santa, my 5-year-old has been on the yeast mold supplement for the past 4 months. How long should we take it? Should we stop and test her now to see if she still has mold? I would do this. Stop and see what happens over the next few weeks. If she's still good and, stays at that same place, I don't think you need it anymore. I think we did the job. Good job. All right. If things get worse symptom-wise, behavior gets worse, retest and let's see what we're dealing with. Second question. She seeks pressure by crossing her legs and pressing her privates. What could be the reason for this? A, it could just be sensory. Or B, is it an infection coming out of the gut? Could be either one. But that kind, and you know what, Santa, I did a podcast a while ago, maybe this summer, on masturbation. And, she's not masturbating, and she's 5. But I would go back and watch that because we do talk about the difference between sensory issues and desire to pleasure yourself in our kids with autism. So that might help as well. Christina, what does not being able to mount a fever mean? It means that the immune system is dysfunctional. And this can happen with chronic infections. Certain chronic infections, things like parasites, things like Lyme, other things, can suppress the host's immune system so that it doesn't get killed. So I think when we see people who don't respond typically with fever and, symptoms to a cold like you should, it's because their immune system is being suppressed by another infection. So I would go after another infection. Selma, histamine C, is that for allergies or to boost the immune system? Great question, Selma. So we have a line of products. Try to see if I have one here. Hey, you do. Histamine C. So we have these supplements. We have it as a powder, a capsule, a gummy. These supplements are designed to lower your histamine levels. So it can help with allergies. It can help with this kind of histamine anxiety and sleep issues that we get. Again, it's not solving the cause, but it helps in the meantime. So you can do both at the same time. You can help reduce those things like histamine and treat that cause with gut infections. Now, it's going to lower histamine levels, period. Will that help with allergies? Yes. Will that boost the immune system? Yes. Can that help with anxiety and sleep problems? Yes. So it can do a lot. Christina, can this be related to PANS? Great question. So And we just did a Pans Pandas podcast recently. And for those of you who are unfamiliar, Pans and Pandas is an autoimmune condition caused by an infection. The immune system then attacks our brain. Okay? Attack the immune system, attack infection, and then attack brain. So if you have a long-standing infection that the body's fighting, if that then causes autoimmune attack in the brain and creates Pans and Pandas, it's still being created by an infection. That infection might be producing oxalates, histamine, and ammonia. So can you see this same thing in Pans and Pandas? Yes, but the reverse is not true. If you have elevated ammonia, oxalates, or histamine, doesn't mean you have Pans or Pandas. It just means you have the infection. And so do you also have that autoimmune attack on top of the infection? There's so much stuff going on with autism. This is why it's so complicated to address. This is why you need to see specialists. So Christina, that's kind of the yes/no answer to that question, but great question. All right. That is all of the live questions that I see here. If you have another question or I didn't answer your question, please retype it in the comments. We'll get to it in a second. But let me step back and review. Oxalates, histamine, and ammonia. These are substances that are normally in our body all the time, every day. And they're normally in our body in certain amounts. When those things elevate, they can cause symptoms. And in our kids with autism, things like oxalates and histamine and ammonia are much more common and prevalent. We saw research that said the levels of those are 3 to 5 times higher than our neurotypical peers. So those things are present. Those things do cause behavior changes. Those things cause hyperactivity and anger and aggression and sleep problems. So you may or may not have had those things tested in your child. If you have or if you haven't, really isn't the issue. The issue is these things come from infections, okay? I don't think you need to go on a low oxalate diet. I don't think you need to go on a low histamine diet, all right? I think what we need to do is treat the cause. And that is so infrequently done in our medicine, 21st century medicine. You know, it's going back to our cholesterol metaphor. I have high cholesterol. I eat fast food. Don't want to single out one. I eat fast food 3 times a day. Well, I could tell you to change that because that's the cause, or I could just prescribe Lipitor. All right.